Hi, my name is Fiona Phillips Davis, and in this presentation I will be talking about the roles and responsibilities of being a midwife. In this presentation I'll be discussing the following: better births. A personalised, quality, patient-centred service is required for every woman because their pregnancy is unique. Better birth involves 7 essential areas. A fair payment system. This ensures midwives should be paid fairly for all the high quality care work they provide for all women. Better postnatal and prenatal mental health care. Community and specialist mental health service means women can see their midwife as much as they need. There are also health visitor and follow-up care from the GP at 6 weeks postpartum. Boundaries being worked across. Boundaries being worked across mean working together as a team, ensuring women get to make their own choices and have access to specialist care if required. This improves outcomes and reduces health inequities such as increasing life expectancy and lowering the chances of mental health illness. Continuity of carers. A small team of 4 to 6 community-based midwives familiar with pregnant women so they can all provide continuity care throughout pregnancy, birth and postpartum. Multi-professional working. Professionals working effectively together, respecting and understanding each other helps break down any barriers in communication, meaning a better level of care is provided to the mother and baby. Own personalised care. Women should be able to make their own decisions of how and where they want to give birth, and the support they receive during the prenatal, intrapartum and postpartum from the providers. They have the right to follow their wishes if the baby isn't in danger. Safer care. Professionals working together will ensure the correct care is given at the right time, reducing mistakes being made. There is a board in place monitoring worrying information, trying to improve the quality of the maternity services. Saving Babies' Lives 2017. The goal is to reduce stillbirths, neonatal and maternal fatalities, the intrapartum brain injuries by halving them by 2030. This was first set out in 2016. This has since been expanded to include lowering the rate of preterm births from 8% to 6%, with a deadline set out for 2015. Fetal growth restriction. Fetal growth restriction is the leading cause of stillbirth. To reduce the chance of stillbirth, a quick delivery of the baby at risk is required. No smoking. Smoking can not only risk the chance of stillbirth, but can also bring early birth, low birth weight, miscarriage, and a sudden infant death syndrome due to baby receiving lots of carbon monoxide affecting the child's health. All mothers-to-be must be tested the CO test so the midwives can advise them to reduce their smoking. Reduce fetal movement awareness. Spreading awareness of the importance of how to recognise when the baby's movements has decreased. The sooner you notice the baby has more chance of being treated, reducing the chance of stillbirth. Monitoring the baby during labour. Babies during high-risk labours need to be monitored using the CTG. Without this, babies have the chance of being being born with brain injuries such as cerebral palsy or stillbirth. Since Better Birth and Saving Lives was launched, the NHS maternity care has improved massively, setting up 44 local maternity systems across the UK, meeting everyone's needs. Antenatal care. Thankfully, most pregnancies are not low risk. However, that does not mean that some aren't high risk, which is where antenatal comes in. The National Institute for Health and Care Excellence NICE clinical guidelines recommend the use of the antenatal assessment tool to risk assess each pregnancy. This is broken down into 5 categories. General. Women over the age of 40 are at higher risk of giving birth to a baby with congenital abnormalities, such as Down syndrome. In 2017, a study released that showed that 30,000 teenage girls a year worldwide die as a result of pregnancy or childbirth. That's 30% higher than mothers who are aged between 20 and 29. Having a high body mass index, BMI, also increases the chance of complications, including preeclampsia, miscarriage, blood clots, high blood pressure, and gestational diabetes. Previous obstetric history. If a woman has previously experienced a caesarean section, stillbirth, gestational diabetes, postpartum, hemorrhage, or postnatal depression, then there is a high risk of it happening again. Midwives have an important role in monitoring the mental and emotional well-being of women during their pregnancy in order to recognise the sign and get them the help they need. Medical history. Women with existing medical conditions such as diabetes, heart disease, epilepsy will have to be monitored carefully throughout their pregnancy to keep mother and baby safe. Family history. Many families who have had a history of genetic conditions such as sickle cell disease, cystic fibrosis, chooses to have the tests and counselling before deciding to have a baby. Present obstetric history. Risks include twins, multi-pregnancies and preeclampsia. Preeclampsia is a potentially life-threatening condition for both mother and baby. The mother will suffer from high blood pressure, vomiting, severe headaches. This also means a baby may not be able to develop properly as the placenta will not give the baby enough oxygen and nutrients. Intrapartum care. Expectant mothers develop a trusting relationship with their midwife. The midwife can be relied upon to offer ongoing advice, help and guidance, such as a birth plan. A birth plan is a record of the pregnant women's choices regarding labour, childbirth and afterbirth plans. This helps the midwife to understand what is wanted without any miscommunication. Antenatal parenting classes. Going to antenatal classes is a great way to receive information, advice and support. It's also a great way to meet fellow expecting parents. This is where advice will be given regarding pain relief, breathing exercises, breastfeeding and caring for the baby. Pain relief. Pain relief takes on many forms during labour. Breathing and relaxation. Deep breathing exercises and relaxation methods are taught at antenatal classes. Massage is also a great physical relief when having contractions. Entonox, also known as Gasnier. It is the most popular form of pain relief. This is administered by the woman herself through a mouthpiece or mask. Pethidine, An injection administered through the thigh in the first stage of labour. It can last between 2 to 4 hours. It can affect the baby's breathing if it is given too close to delivery. Epidural. Administered into the epidural space of the spinal cord. It numbs the nerves carrying pain impulses from the birth canal to the brain. For most women, it gives complete pain relief. It is very useful for women who have been in long or painful labours. TENS machine. TENS machines are electrodes taped to the pregnant woman's back. These stimulate the release of endorphins, which is a natural painkiller. TENS is most effective during the early stages of labour. What to expect? The onset of labour approaching can be an exciting time, but it can also cause a lot of stress and anxiety. This is where the support and advice from your midwife can help. The midwife can provide advice, physical, emotional, psychological support for the woman and family. This could be anything, helping you plan your route to the hospital, providing relevant contact numbers, or what to pack in your hospital bag. The postnatal period. The postnatal period begins straight after the baby is born and can last up to 6 weeks. During this time, the midwife will monitor the needs of the mother and her family to ensure they are coping with a new addition to the family. New mothers need to make sure they are looking after themselves as well as the baby. The midwife will give them support to make sure the new mother is sleeping, eating well and exercising. NICE Quality Standards 2015. In the postnatal period, there are recommendations by NICE for the mother's physical and well-being. Prenatal care. Midwife will give the right treatment to the mother who has any discomfort, prenatal pain or bad odour. Dyspareunia. The midwife will reassure mothers that sex can be resumed as many are worried. Any difficulties they may have, the midwife will give advice. Headache. Medical referral will be made for the mother who has severe headaches. Those who have had an epidural are likely to have bad headaches. Fatigue. If the mother is feeling fatigue after a long time, she'll be tested for anemia. Constipation. A woman will be given advice on how to improve their diets if they have constipation. Visceral incontinence. If it doesn't resolve, they'll be sent for urgent treatment depending on the severity and how long it's been happening for. Urinary retention. Once a baby has been born, the mother needs to pass urine within 6 hours. Urinary incontinence. Pelvic floor exercises are taught for the urinary incontinence. They are strengthened the muscles and maintain good posture, preventing back problems in longer term. Contraception. Contraception should be asked in the first week after the birth, depending on the culture or religious beliefs. Ovulation can happen as early as 28 days. The baby's physical needs. Feeding the baby. New mothers will receive advice on creating a new routine with feeding the baby with either breastfeeding or bottle feeding. Birth weight. Babies can lose 10% of their birth weight after birth, but should get back to their weight within 2 weeks. Midwives will use the baby's personal health record book to monitor and keep record of the birth weight. Immunisation. Midwives also provide information about the immunisations the baby needs to protect them from future illnesses such as meningitis. Baby skin care. Baby skin care is also important to mothers. Will be provided information on bathing, avoiding nappy rash and taking care of the umbilical cord. Baby's poo. The baby's poo is different to a normal poo, so mothers often require information on what to look out for. The poo can be greeny, black, sticky or tar-like substance from when the baby was in the womb. Sleeping. Sleeping advice are also important, such as putting on their back on the bottom of the cot, wrapped up safely and in the same room as their parents to avoid a risk of sudden infant death syndrome. Smoking is known to increase the risk of cot death. Social and psychological needs. Having a new baby is very challenging to most families, with them having a new responsibility, learning new routines and lack of sleep. The mother can find everything so overwhelming with a new baby or adjusting to a new baby into the family. So NICE quality standards made recommendations as mothers can suffer from emotional well-being. A mother should be asked about their emotional well-being every time they meet the healthcare professional. Any changes in their moods or behaviour should be treated by medication or helpful advice how to improve their emotional well-being. Baby blues. Baby blues occur 10 to 14 days after birth, when mothers feel a lot of anxiety, crying a lot or generally low mood. They will be assessed for postnatal depression if it doesn't subside. Mental health. Taking care of your mental health is very important. Mothers can do this by resting, having gentle exercise, talking about their feelings with someone else, or having support to look after the baby. Women often neglect their own needs because of taking care of the baby. It can be overwhelming with their crying for milk, nappies, changing, tiredness, or struggling with their wind. Nursing and Midwifery Council. It is a registered charity that was founded in 2002. It maintains all midwives and nurses are eligible to practice in the UK, set and reviewed in lots of training, education and performance. Under the NMC, midwives are expected to have the highest standards in working with women, giving them high quality care in a safe environment. Education. Being a midwife is a high standard job, so receiving education is priority to keep both mother and baby safe. They're expected to know every detail about pregnancy, labour, childbirth and have fantastic communication skills, so the mothers are reassured and will develop trusting relationships with the midwife. Midwives will need to share lots of information, such as breathing exercises and caring for the baby. They also need educated on what they can do whenever an emergency arises during labour and the mother's health and well-being after birth. They also need to learn how to keep on top of their record keeping so everything runs smoothly between health professionals. Conduct and performance. Midwives must be capable of using the essential skills, meeting the needs of women and their baby, providing the right care, only giving out medicines they have been trained to use, and don't provide any care or treatment they haven't been trained on unless it's emergency. All records must be kept for 25 years. Fitness to practice. If a midwife isn't fit to practice, the NMC will remove the midwife from their registered either temporarily or permanently. They must ensure their knowledge and skills are on top to date and they provide everything that is expected from them. The Code. The Code started on the 31st of March 2015 by the Nursing and Midwifery Council. They have made 4 points that midwives must follow. If they are not, they will be removed from the registrar. Prioritising people. Midwives must listen, respect and act in the best interests of the people, always ensuring they are being responded to and their needs are being met. Every mother-to-be wants to be treated as an individual, making their own decisions with the advice and support from the midwives. Practice effectively. Midwives must work to the best of their ability by working together, communicating by using pictures and writing things down. They must support each other by sharing and respecting their experience, skills or knowledge so the mothers will always receive the best care possible. Midwives need to keep up to date with advice of alcoholism, drugs, intrapartum, hemorrhage and postnatal depression, to name a few. They also need to record things throughout so other health professionals are on track of any issues a woman may have. Preserve safety. Midwives must raise concerns if they believe their patients or the public are at risk of their safety. They must offer help, give advice about the care and treatment available, prescribe medicine that they are trained to do. During the antenatal care, they must recognise the signs of mental illness, domestic violence, or even the mothers neglecting their own needs, such as nutrition, exercising, and personal hygiene. During intrapartum care, they must raise concerns immediately and only act out to the limits of the knowledge in the situations, such as a sudden drop in blood pressure, hemorrhage, or instrumental delivery. In postpartum care, they must look out for signs such as postnatal depression or emergency situations like preeclampsia. They are also responsible for looking after their own personal hygiene to prevent infections when helping the mother with feeding or the baby's umbilical cord. Promote professionalism. The midwife must ensure they remain professional at all times, meeting their job requirements and dealing with complaints against them with dignity. Midwives must treat everyone fairly, with no bullying, discrimination or harassment, respecting their cultures, disability and sexuality. They are responsible for keeping their knowledge and skills up to date by learning and doing activities regularly. They also have a 24-hour access supervisor who they meet once a year. Communication. To be successful, the professionals will need to share ideas and give as much information as possible, respect each other, have commitment, understand their own responsibilities and what their job roles entitles. Different teams that communicate to achieve the goal sharing their responsibility can be permanent. Permanent is the best form of communication because everyone knows everyone's way of working. Therefore, the effectiveness, speed and productivity of the team is great. Interdependent. Interdependent usually comes together when things get complicated because they all have different qualities and specialities in what they can do. Cross-functional. Cross-functional is where everyone with similar skills works together to achieve a task together. Multidisciplinary. Multidisciplinary are different services or agencies of people professionally working together to meet the person's needs. There can be pros and cons in this type of team, such as a patient can get more than one option for treatment, but the communication between health professionals can be poor or confusing. The other example is knowledge and expertise can be shared, but that can sometimes cross boundaries for the team and become a problem for the patients. They can often walk away knowing they have been taken care of in good time, and for the staff. They often learn new skills, increasing their professional experience. They all must ensure the information being exchanged are short, clear and accurate. My conclusion: the role of a midwife is to ensure that women receive the care they need throughout pregnancy, childbirth and postnatal period. Much of this care will be provided directly by the midwife, whose expertise lie in the care of the women and babies during normal birth and pregnancy. Where obstetric or other medical involvement is necessary, the midwife continues to be responsible for providing holistic support, maximising continuity of care and promoting a positive birth experience for women. I would like to say thank you to listening to my presentation and going through my slides. I thoroughly enjoyed this unit and I feel I've gained such a good understanding of the roles and responsibilities of a midwife. Thank you.